Okay, good morning, everyone, and welcome. We are going to go ahead and get started with our second regional convening for Healthy Northeast Ohio. I want to thank you all for being here this morning. We will start with some brief introductions. My name is Libby McGraw. I am the Regional Community Health Improvement Manager for Healthy Northeast Ohio, and I am based at the Center for Health Affairs. And Sarah, would you like to go ahead and introduce yourself?
Sure. Good morning, everyone. Thanks for joining us. My name is Sarah Zabo, and I am a data analyst at the Cuyahoga County Board of Health, and I serve as the data analyst and one of the website administrators for Healthy Northeast Ohio. So welcome.
Thanks, Sarah. A reminder that we have muted all lines upon entry, so to please direct any questions or comments that you have this morning to the chat box, which should be located just in the lower right-hand corner of your screen. And do be sure to address them to everyone if you can, just that way we can make sure that everybody sees the questions and comments. So if you're able to do that, we'd appreciate it. I will also mention that this event is being recorded, so once that link for the recording becomes live, we will share that out with everyone, and we will also post it in our resource library on Healthy NEO. As you may have seen in our reminder email yesterday, we have a very exciting agenda for today. We are going to start with just brief overview of some of our updates. We are going to check out a story feature that is live and available on our site. After that, we are going to hear from many of you to hear some updates about community health needs assessments. And then I am very excited that we are going to be joined later by Chase Holmes of the Cleveland Clinic, as well as Karen Cook from Metro Health, and they are going to be sharing about social determinants of health. I know a lot of you are likely already familiar with our efforts, but just in case we have any new individuals joining who aren't as familiar with us, we did want to provide just some brief background information. We did launch the Healthy Northeast Ohio site in 2019, and we continue to use the Conduent HCI platform. We currently maintain a presence in 9 counties across the region, and in 2019 through the end of this year, our efforts were funded by a grant through the HealthComp Foundation, and we also received generous partner contributions to help support that work as well. I would like to share a few updates about Healthy Northeast Ohio before we jump into the rest of our agenda. We are very excited this month to be celebrating 2 years of the website, so thank you all for your continued use of the website, continuing to use us as a resource for data for other general resources. So we are very excited to be celebrating our second birthday. We are also very pleased to welcome 2 of our newest counties, Ashland and Geauga, to the platform, both of which just joined the platform over the last couple of months. We've been working closely with Vicki Taylor at Ashland County, as well as Sarah Sullivan and Magali Rios at Geauga County. So we thank you all for your efforts and collaboration as we worked to round out our geographic footprint. And then lastly, as many of you are aware, we did recently pursue funding from the HealthComp Foundation to support our continued efforts from 2022 through 2024. And we are very excited to share that we have received approval for this funding. So I did want to take just a moment and thank all of our partners who did commit to financially support this work moving forward. And I know many of you received messages from myself, from Terry Allen at the Board of Health, Christine Dodd at the Center for Health Affairs. So we do extend our deepest gratitude for your support. With that, I think I'm going to go ahead and turn it over to Sarah, and we are excited to get started this morning with you. So Sarah, I will go ahead and let you take it away.
Okay, if you could just navigate to the next slide, Libby. Thanks so much. So again, good morning, everyone. Today we thought we would highlight the stories feature, which is it's a newer tool that's available on the back end of Healthy Northeast Ohio. So Libby and I have access to this tool. But basically these stories allow you to use a variety of interactive data visualizations and then custom text and even any images that you might want to include to create a cohesive narrative about the health of your community. So these stories are made up of chapters, pages, and items, and I'm going to give you a sense of the different items that can be included in the stories on my next slide. But I also wanted to share that there's a couple ways that once a story is created that it can be shared. So you could, for example, email or embed a story URL and share it with others. You can also link a story on another website, or you can add a story to a web page on Healthy Northeast Ohio. And the screenshot you're seeing there is the regional demographics profile that I'm actually going to show you in a few minutes. But I actually did participate in a feedback session with our vendor, Conduent Healthy Communities Institute, on this newer feature. So it was just interesting to hear from other Conduent clients how they've started to use it. So some shared that they have used it to create, instead of a static, say, progress report, they created this more electronic online progress report. Many of the other Conduent clients also talked about using it for sharing information from their CHNAs. And then one client also used it for, I think they call it like a year in review, which they would typically put out using like a Canva template. So again, just to give you kind of a sense of what you can use these for, you can create a story really around anything you're interested in, and they can be really tailored. Libby, would you mind going to the next slide? Thank you. So again, as I shared, there's a variety of different, they call them items on the back end that can be added to these stories. So, and I apologize if these are a little bit small, but I just wanted to give you a sense of, again, those different data visualizations, tables, maps, and then custom images or text that can be added. So you can see there that you can include a bar chart, and there is the option to add comparison lines. So say, for example, a line showing the state value. You can include scatter plots, which just allow you to explore the relationship between two indicators. There's also these time series charts, so looking at indicator and demographic data over multiple time periods. And then there's a custom HTML tile, so that just is where you can add the custom text and images that I mentioned. There's also time series table. So again, looking at data for an indicator over multiple time periods, but in a table format. There's a data table, which is just showing data for one time period in a table. And then there's a couple different map options. So there's a community map, which just shows a map of selected locations, but it doesn't actually show data. So you're going to see that actually on the first page of the regional demographics profile that I'll show you. And then there's also this resource list or map option. So you can either add a list of resources or a mapped resource collection from the resource library in Healthy Northeast Ohio. And then the last one is a data map. So again, showing a select indicator or demographics data for whatever locations that you've selected. So those were just the two slides I wanted to show you about the story. And then Libby, I'm going to go ahead and start sharing, and I will show you the regional demographics story. So give me just a second. Libby, could you confirm that you're seeing the website?
Yes, I see the regional profile.
Okay, thank you. Okay, so again, I just wanted to briefly walk everyone through this regional demographics story that we created on the website. And this was created in response to feedback that we received that it would be helpful to have a regional demographics profile. We made some static county-specific demographics reports. So we do have a static regional demographics report, but also thought it might be helpful to use the story feature just because it is a little bit more interactive. And to navigate to this, if you haven't looked at it before, on the website, it's under the Explore by County tab, and then you would just click Healthy Northeast Ohio region. Um, so again, this is the story. At the very top, you're going to see the story title, and then there's this 3-bar symbol. So if you hover over that, this is going to show the table of contents for the story. And then just to give you a sense of the navigation for these stories, you can use the table of contents to expand these chapters and then select a specific page, or you're going to see there's navigation arrows that are going to be at the top right, and then if I scroll to the bottom, also at the bottom of the page. So again, just a couple ways to navigate through these stories. So say, for example, I was interested in looking at population by sex. I would go to this page. And so, as I mentioned, the graphs in these stories are interactive. So if you wanted to say, only look at the female population. If you click on any of these subgroups down here, it will actually deselect those. And I wanted to mention that all of the graphs in these stories are also downloadable, again, using that 3-bar symbol at the top right of the graph. And I alluded to it, but some of the other comparison values that we can show in bar graphs, for example, would be a state value, US value, or even a Healthy People 2030 target if it's available. And then in this particular story, in addition to a graphic, I also did include a data table, so you can see that this data can be downloaded by just clicking download CSV. So again, feel free to check this out. I just wanted to mention that because it is on the feature is on the back end of the website, it's not something that all website users can go to the site to create their own story, but Libby and I are more than happy to work with anyone if you have ideas of a story that you think might be helpful to you or something we could add to the website that would be helpful to all website users. We're very open to any ideas, feedback, etc. So again, please reach out to us if you are interested in exploring what that might look like and you would like to have a story created around a particular topic that you're interested in. So Livy, I'm going to go ahead and stop sharing and turn it back to you.
Okay, great. Thank you, Sarah. And I know many of you likely already have our email addresses, and of course you can get in touch with us through the Contact Us page on the website. But as Sarah mentioned, yes, we are very open if there are ideas that you or another partner that you're working with have on a cool way to kind of visualize data in the different story features that Sarah was showing. We are very open to that. So she showed you the regional demographics story, and that was one that we were really excited to bring just because it was in an effort to be responsive to our partners, and that's what we're here to do, is to respond to all of your needs as well. So thank you for that, Sarah. And I'm going to go ahead and share just briefly for a moment, and then I'm probably going to take the screen down again just because I know we're moving into more of an open discussion. But we are going to go ahead and move on to the next item in our agenda. So in June, we heard from many of you about current community health programs that you're working on, what's working well, maybe some barriers that you were experiencing. And we are going to pivot a little bit today. And so we're going to be hearing from a few different partners about the upcoming community health assessment and community health needs assessment cycles. We know that many of you are working on that. Maybe you're just in the planning phase for either 2022, years after that, but we did want to start some of those conversations. So we are going to be hearing from a few of our different partners specifically about current updates, any progress, and we also are going to be talking a little bit about how COVID-19 is being incorporated into the next cycle. So I know some of our partners may have immediate feedback, may have immediate thoughts. Some of you I know may be interested in more just listening and hearing what's going to come out of this conversation. So we are going to go ahead and open that floor up. So I do have a few individuals who we did invite to share and who did agree to share. So first up, I'm going to go ahead, and I think everybody is on. I did check that a little bit ago. But Jillian Cremona from Lorain County, if you'd like to go ahead and come off of mute and share with us any updates for your CHNA, that'd be great.
Hi, yes, good morning. Jillian Cremona, Lorain County Public Health. So Health Department in Lorain County, obviously in partnership with all of our healthcare providers, mental health board, all the usual players. We are in kind of the final planning phases for our CHA refresh. So things we're working on right now are getting really a review of the data that we have available to us right now, kind of sorted and organized, and we are planning for both community focus groups and key stakeholder interviews. We did an extensive review of who normally gets interviewed or focus groups or data that's usually available to us. We're analyzing all of that, but we're also doing a big push around getting voices that we may previously not have heard from, so to get a perspective that we may be missing. So
That's great, Jillian. Thank you so much. And then, and if you don't have any response to this, that is totally understandable. Again, I know different counties are looking at this in different ways. Do you have any thoughts, or is Lorain County looking at all on how to incorporate COVID-19 into the next cycle? Is that something you guys have talked about and navigated as you kind of reach these final planning stages? maybe we lost Jillian, so we'll go ahead and give it another moment and then we can go ahead and move on. Okay. Okay. Well, thanks, Jillian. Thanks so much again for sharing that. And then if we're able to hear you again, maybe we can circle back. So I'm going to go ahead and move on to Elizabeth Fiordalis from the Cleveland Clinic. So Elizabeth, I believe I saw that you were on. If you're able to come off of mute, and I think I can unmute people too if people are having any issues.
Yes, thank you. Appreciate it, Libby. We are at Cleveland Clinic moving through the next planning stages of the CHNAs, and we are working closely with several, I think 6 or 7 counties on developing some shared resources. I know that we've learned from the COVID piece, working with our Florida hospitals that just completed their 2021 cycle, how to kind of position the COVID for our moving into our Ohio CHNAs. One of the things that we had put into our past CHNAs was a caveat in there that said, you know, the needs that we see in these CHNAs represent current data and past data collection. So if something emergent shows up, we would have the ability, just referencing that, know that we could, you know, shift our resources. So don't hold us, you know, in concrete resource impact eval because if something shows up. So we're going to take the opportunity for this round to be able to say, you know, even though in 2019 we identified these specific needs, we just need to know that an emergent need of COVID has appeared and has amplified those needs. We found out that if we go through those needs piece by piece, that we can see that chronic disease has been impacted, social determinants of health have impacted, even increased, you know, tremendously, and take some time to identify each one of those needs and just reference how they were impacted by COVID, even though they weren't identified. COVID wasn't identified in the CHNAs. So I hope that gives some kind of perspective. We're still working on it. What's the best language to do that? But not to ignore it, not to call it out as the only thing that we're looking at, but how it interplays with those other needs that are there. And those other needs, by the way, have been exacerbated by COVID.
Thank you so much, Elizabeth. I appreciate that feedback. That's great to hear. And then Jillian, I think we might have you back on. So let's see if we're able to hear you.
Yes, can you hear
Okay.
me now?
Yep, we can hear you.
All right. Yeah, so sorry. I don't know what happened. My computer screen just went blank and everything restarted. So I will switch over to my phone if that happens again. But like I said, we're trying to hear from new voices. We're doing some particular outreach around employers, large employers, particularly our traditional people who have been interviewed or used in focus groups are the traditional players that you think of: Parks and Rec departments, health agencies, CEOs of hospitals, that sort of thing. So while we're including them, we're also going to do some push to make sure that we're getting all of the demographics that represent Lorain County. So those are the pieces we're working on right now. The key stakeholder interviews will be through our consulting firm. Those will kick off in January. Series of focus groups will also kick off in January as well. I will be leading those myself. One of our internal epidemiologists has already started crunching the data available both on this website and through census. Some of the data that's been previously collected on our many analyses through, you know, grant work and that sort of thing throughout the last year or two here. COVID, we're going to include. I think we've done a big push around COVID data on our annual reports. And we'll include it on this, but I don't think we're going to make it a specific priority in and of itself. We'll incorporate those within the priorities of, you know, tobacco and substance abuse, of the larger, you know, cardiovascular health as pieces there. So I don't anticipate it getting its own kind of identified section, but rather be kind of like woven throughout. So there we go.
Thank you, Jillian. Thanks so much. And thank you for bearing with me through, of course, with COVID, we also have our technology barriers that we experience. So thanks for
Yeah,
jumping
I
back on. I appreciate
don't
it.
know what happened.
No,
Yeah,
all
thanks.
good. It is all good. So thanks, Jillian. And then if anybody has, and I will just pause really for a brief moment, if anybody has questions or follow-up comments for either Elizabeth or Jillian or any of our speakers moving forward, just a reminder to please enter those into the chat and we can make sure that we address those. If not, in the moment, we can address them at the end as well. So we are going to move on. I believe next up we have Natalie Lonjek from the Medina County Health Department. So Natalie, I believe I saw that you were on. If you're able to come off of mute and share the updates for Medina County, that would be great.
Okay, there we go. I think I got it.
We can hear you, Natalie. Thanks.
Okay, and I was actually trying to start my video too. Okay, there we go. Hi, my name is Natalie Lonjak. I'm the Health Promotion Supervisor at Medina. I am brand new to this role, so I very much appreciated the navigation overview of the stories feature on the website as I'm becoming familiar with the website. So I don't have much of an update today, other than we are in the process of working on our youth survey. We finalized the question selection, and our contractor is currently working with our schools in Medina County to facilitate that. An addition we made, though, in relation to COVID is we added a couple new questions regarding mask usage. So that'll be something new that we'll be doing in 2022.
Thanks so much,
And
Natalie. Thank you. I know I'm jotting down notes too. When we send out our meeting link, we will also share some brief updates and any great information that we received from today. So I'm doing the navigation of our WebEx platform and also taking notes by hand because of course some of us are old-fashioned that way. So thank you, Natalie. And we're going to move on to Becky Lehman from the Portage County Health District. So Becky, if you're able to come off of mute, we'd love to hear any updates from down in Portage. And Becky, I can see that you came off of mute. I'm not hearing you if you are attempting to speak at this time. Give it another moment. Okay. Maybe we can, Becky, I can send you a private message and we can try and navigate that. But we'll go ahead and just move on for now. And then of course, circle back to Portage in a few moments. Samantha Smith from the Cuyahoga County Board of Health. Samantha, I know you may have been on earlier. I didn't look and see if you were able to join in again. Samantha, are you on? Are you able to provide an update? And I know we have a couple other Cuyahoga County representatives on, so we can always revisit.
I'm on. Are you able to hear
Okay.
me?
Yep, we hear you.
Hi. Hi, Samantha Smith here at the Cuyahoga County Board of Health. I think Dr. Gull would probably be best to speak about the work, but I'll do my best just to provide a general update on what I know. We're again, working towards our next cycle for the community health assessment work. Our goal is sort of a collaborative assessment between the public health partners in our community as well as the hospital systems. So we have started our meetings. A steering committee kind of leads that work. In terms of, the impact of COVID, the role of COVID, these discussions are happening now. Obviously, it's going to be top of mind, why we're doing this work. I think kind of some of the direct implications we're discussing, possibly not doing survey data collection this round. We did a large comprehensive surveying last cycle. And I think the vibe of the steering committee is to focus more on other opportunities of primary data collection, like focusing on interviews or focus groups with social resource providers and things like that. And we're also exploring working with a vendor to help kind of coordinate and supplement like pieces to support the work, given just how stretched everyone is. So I think those are maybe two biggest changes that we're looking at, but certainly we're definitely trying to stay collaborative and align with the different public health and hospital systems as we were able to do the previous year.
Thanks, Samantha. And then I know that we have a few other Cuyahoga representatives on the line, so I do want to open that up for some of our other steering committee members from up here in Cuyahoga County. Specifically, Elise, do you want to chime in with anything for university hospitals or share with any updates on the focus groups? Not to put you on the spot, and if there are no updates, that's okay too.
Yeah, good morning, everyone. Thank you, Libby. I don't have too much to share that's that's really different from what's already been said. We're working collaboratively across all of our counties to sort of plan out and get in writing what we're going to be doing in terms of surveys, focus groups, key informant interviews, and all of that. But nothing additional to share there.
Great, thanks, Elise. And then I believe Becky is having a couple of issues with sound, so she did send me, and I think she sent this to everyone, a few updates for Portage County, but it looks like they are starting their data refresh for their CHA as well as other community partners. So they're looking to maybe do a YRBS for their primary data along with key stakeholder interviews. So thanks, Becky, for adding that into the chat box. And then at this time, we do want to spend just a few moments to open it up. I do know that we are moving through the agenda, so if this conversation is a little bit shorter, we can go ahead and move on to our guest speakers, Chase and Karen. But we do want to make sure we offer the time to go ahead and share for others who are interested. So I know we have a few other counties who are on the line, Ashland, Geauga, Summit County. So if anybody from those counties to chime in with any updates for what you have going on in your counties, we are very open to hearing from you. So I will go ahead and mute myself for a moment. And if any of you would like to come off of mute and share your updates, that would be great.
Thanks, Libby. And I saw that Samantha also added a little extra tidbit to the chat saying that for Cuyahoga County, we do intend to use the secondary data from Healthy Northeast Ohio. So thanks, Samantha.
Yes, thank you for that. That is great. Okay. Okay. Well, we can, of course, circle back to this if people during our next portion of our discussion feel that they would like to share their updates as well. We did want to go ahead and take a few moments to also open up the discussion for COVID-19. And again, I know every county is kind of at a different stage and people are still working in real time through what this is going to look like. But we do want to open that up again and just see if there are any other innovative approaches to engaging community members. I know this is something that we've been talking about in specifically in Cuyahoga County, how we can, engage our individuals and community members due to COVID-19 being obviously the big item on everybody's mind and making it a little bit harder to engage community members in person. But just wanted to open it up and see if there were any other innovative approaches that folks are thinking of using to approach community members. And then Vicki Taylor did also add to the chat, thank you, Vicki, from Ashland County, that they will be using data from Healthy Northeast Ohio as well. So that's great to hear. Okay. All righty. Sarah, do we want to, not to put you on the spot, are there any other major questions that we had on our list that we wanted to address to the group before we move on to Karen and Chase? Okay.
Sorry, Libby, I was looking
you're
at
okay.
our list. No, I think, we were just wondering if people wanted to share just generally how COVID might be impacting their next CHNA cycle, engaging the community, even with data collection. I know it sounds like we've heard a couple things, possibly doing YRBS survey, et cetera. But yeah, if anyone just had any thoughts they wanted to share, just generally, I guess, about how COVID is impacting that or how you're going to be shifting that you want to share with the group, that would be great.
Thanks, Sarah.
This is Samantha with Cuyahoga County. I can add that in our previous cycle, we did engage community health workers to try to help with some of our community outreach, our surveying, our kind of input on prioritization of top health needs. And so I think we're hoping to do that again, but it also, we've had to obviously more recently kind of be cautious with, public activities and that group people and face to face. So I think it's a challenge. I think it's still up for discussion, but we're certainly hoping to kind of have that community engagement as much as possible, and hopefully we'll be able to figure it out.
Thanks, Samantha. Yes, great addition there with the information about community health work.
Libby, it's Elizabeth. I just wanted to add just one comment. It was interesting, again, just kind of as a reference. I know we're all in Ohio on the same CHNA cycle. And some of our hospitals are on a different cycle out of state. So just learning by experience, right? Because we were in the middle of the pandemic, we had to stop what we were doing to sit there and wait, and then go back, and we actually had to re-interview people. But what we found was taking the questionnaire that we use for our key stakeholders that we had traditionally used for our CHNA, and then adding the question, how has COVID impacted, the needs that we have identified or we have addressed, really opened a different kind of discussion that was much more reflective of the social determinants of health. It was just really interesting. It wasn't as standard as we had seen in the last 3 cycles. It really opened up a different way of community collaboration, communication, and how we could shift a little bit in how we address these needs as a community. So just that one question, just how did COVID impact the rest of the needs, was really an interesting key stakeholder conversation. Just an FYI.
That's great. That's really great to hear. And then that's
Li-
before, yeah. Oh, go ahead. Sorry, I cut somebody off.
Libby, this is Chantel. Thank you so much. And just kind of piggybacking off of something that what Elizabeth said. When I think about the community health needs assessment and what she even said earlier today, as far as what COVID had done as it related to exacerbating some of the other needs, would definitely love to see more highlighted around digital access and literacy and devices. My colleague is on this call right now, Meredith Sealy, who is working on a huge project, a huge lift in adding those questions around digital access to social determinants of health and actually screening and connecting people to resources. So I know that we do have data out there. I think there may be some mention of it in the community health needs assessment, but would really like to see it have, some definite focus when we look at the CHNA this next time around.
Thank you, Chantel. Thanks for those comments about access and digital literacy. And then Sarah, would you mind maybe, not to put you on the spot too, but do you want to share briefly just that we do have a couple of digital literacy indicators that are available on the site?
Sorry, I was finding my mute button. Sure. Actually, I might just share my screen. I think it might be easier if that's okay. So bear with
That
me.
is totally fine. Thanks. And thanks
Sure.
everybody for your thoughts and feedback. This is really great to hear this discussion on where everybody's kind of thinking, the direction that people are planning on going. I'm finding this very valuable. So thanks for your input. So yeah, Sarah's going to quickly show, and I believe I did share that. I believe Meredith does know that this dashboard does exist, but for those maybe who are outside of Cuyahoga County, since we are doing a couple of different efforts through a digital equity coalition up here in Cuyahoga, maybe this can be some helpful information for those who are in other counties. So go ahead, Sarah. I'll go ahead and mute.
Thanks, Libby. Can you see my screen, Libby? Yes. Okay, perfect. So I did that quickly, sorry. So if you go to the Healthy Northeast Ohio homepage and then you go to Explore Data and then this first drop down, search for data and curated dashboards, we have several curated dashboards or just pre-built dashboards on the back end. So we actually did create this digital access indicators dashboard. So I'm just going to go ahead and click on that. So again, this just includes, I think it's about 10 indicators related to digital access that are available at a variety of geographies. So they should be available at the state, county, city, zip code, and census tract levels. And you can, on this page, you can use this drop down to select the location you're interested in. But these mainly are coming from the American Community Survey and then also some additional indicators that we paid to have added to the site coming from Claritas. So I encourage you to check out these indicators. As Chantel said, I know this is a really important issue right now that's being talked about. So please do feel free to check this out at your leisure and contact us if you have any specific questions.
Thanks, Sarah.
Sure.
And thank you again, Chantel, for bringing up digital access. Okay. Any others who are on the call that would like to share any feedback on anything that we've been talking about? Maybe other items that we haven't talked about yet, but related to the CHNA that are maybe top of mind for you?
And Libby, I saw that Meredith put in a comment in the chat. I'm sure everyone saw, but thank you to Chantel for highlighting. And yes, Karen, we are working closely with Metro on this as well. Libby, I also have shared this dashboard with our internal digital access committee and they found it super helpful. Thanks, Meredith.
Yeah, thank you, Meredith. Thanks so much. Okay. Well, I'm going to go ahead and share my screen as we move into the next segment of our agenda. We are running a little bit ahead of schedule, which is okay. I know we're still getting the feel of the timing for these regional convenings, so we thank you all for your participation as we kind of worked through the group discussion. So I'll go ahead and get my screen shared, but if anybody else feels that they want to come off mute before we move into the next segment, please, we do welcome you, and please do that. So give me one moment and I will go ahead and get us ready for our next session. Okay. Sarah, can you see my screen? Thanks. Thanks so much. Okay, so we are going to go ahead and move into the next portion of our agenda. At the regional convening in June, which was our first one, so this is only our second one. So we're really excited that many of you decided to come back and be with us this morning. But we did ask for feedback about what you were interested in hearing more of. And one of the things that was echoed in those conversations was social determinants of health. And Elizabeth had addressed this earlier too. So that was kind of a nice segue into our discussion now. But to be responsive to that feedback, we did invite Chase Holmes of the Cleveland Clinic and Karen Cook of Metro Health to talk about their experience on this topic by using the Unite Ohio platform. So they are going to be sharing a little bit about what they used to do to address how their experience has been in the implementation of Unite Ohio, and then they will also be sharing a little bit about how this process is impacting the community. So I believe you guys might have your own slides, so I will go ahead and stop sharing, but I will go ahead and welcome Chase and Karen to come off of mute and join us for their session.
Great. Well, good morning, everybody. Very happy to be here, and thanks for the invitation to speak to the group today. Chase is going to be sharing and driving our slide deck, so thank you, Chase, for that. And as Libby mentioned, my name's Karen Cook. I currently serve as Director of Healthy Families and Thriving Communities with Metro Health's Institute for Hope. And if you're not familiar, HOPE is an acronym that stands for Health, Opportunity, Partnership, and Empowerment. And it is the Metro Health System's commitment to identify and take action on the social determinants of health and the health-related social needs of our patients.
Thank you. First off, can everybody see my screen? Just making sure.
Yep.
Make sure. So my name is Chase Holmes. I work in operations for Cleveland Clinic in the Department of Community Health and Partnerships. More recently, I served as a United Systems Administrator. So it's my goal to improve the efficiency of this platform and ultimately improving the lives of those we serve in our communities. Come on, there we go.
So we wanted to start just by rooting this in a little bit of history and history that relates to the community health needs assessment process. So while we'll be focusing on our work with Unite Ohio today, I really want to acknowledge that HIP Cuyahoga many years ago now made it a key priority to address how to better link clinical and public health, thanks to the strong leadership of Dr. Heidi Gullett and others. And through that stated priority, a lot of work was done in Cuyahoga County that, came to fruition in 2018 and then even greater in 2019 to do collaborative community health needs assessments. As many of you on this call have participated deeply in that process, but the local health departments and multiple health systems coming together around a shared needs assessment. And in 2019, one of the identified priorities was to improve community conditions with a shared strategy amongst those stakeholders to develop a shared learning community to better link social service resources and community. So Unite Ohio is one manifestation that really, came through this historical process that, was really led by so many terrific folks on this call and throughout the community.
Yep. And as Karen kind of mentioned during our today's discussion, we spoke about how the COVID-19 pandemic truly impacted the way we engage communities. So a lot of times our services really transferred over to either virtual or telephonic encounters. And that's why today we're talking about the Unite Ohio platform. So what Unitas intends to do is connect health systems and community-based organizations in order to deliver integrated care for community residents through a shared technology platform. So when you think about how it's kind of unique to other aspects behind things, I love my computer. There we go. It don't want to work me today. So think about you're able to send direct and secure referrals to organizations, which means you're able to share client information, which is HIPAA compliant. You also are allowing bi-directional communication between organizations. A lot of times when we send referrals, a lot of times there is that gap in not knowing if a person's need has truly been met. And we are able to send these referrals either directly from a person's health record or via a web-based application for those in non-clinical settings. We are able to get real-time communication back regarding referral status to help close those social care needs. And currently, there are over 150 community-based organizations on this platform participating, sending and or receiving referrals, which are providing over 20 different types of services, which can range from food services, housing needs, behavioral health needs, transportation. And we always are trying to amplify the platform for more types of services, especially in geographical regions. The Unitas platform is free to most community-based organizations. So individuals like Cleveland Clinic, Metro Health, and I will just say UH, who is probably come onto the platform, are sponsors, so we do pay, but everybody else, it is free to join. And for organizations, you can have the option to either send or just receive referrals. So there is that option, as well as organizations have the option to include all or some of the services within their network. So sometimes an organization might be providing 5 types of services. They might only actually use 2 on the actual platform. Are there any questions on this so far before I move forward? All right.
I'm
Just to
checking
kind
the
of
chat too, Chase, and I'm not seeing everything, so you are good.
Copy. So can I give you an idea? United Ohio went live in September of 2020, but that was primarily in Cuyahoga County. We did expand it to Lorain, Medina, Summit, Port Geauga, and Lake, kind of more so in March of this year. Cleveland Clinic went live with Unitas in July, so Metro was a little bit ahead of us in that curve. But we're also seeing that some of those, even outer ring counties like Erie, Huron, Ashland, Wayne, Stark, Ashtabula, are starting to go live this past month as well too. So we're looking to expand this actual platform.
And this graphic just sort of walks through the flow of you know, what a user and an individual might encounter using the platform. So in our case, as a health system, we are screening for health-related social needs for our patients. So we may have a care coordinator or a social worker, or a patient may have an opportunity to self-screen through our 22-item questionnaire that covers 9 different domain areas, including digital connectivity. So thanks to the group for the interest in that. So as needs are identified, that provider can get the consent of the patient to make a referral on their behalf using the Unite Ohio platform. And that consent is universal. So it's not for every single referral that's made. It's a consent for whichever referrals and however many referrals may be made through the platform on behalf of that individual. So then the platform itself then serves as that coordination site. So in this example, a healthcare provider on behalf of a patient may send a direct referral, for example, to the Greater Cleveland Food Bank. So it's a provider to provider referral. In the past, we may have provided our patients with a phone number to call, or, you know, really sent them on their way with some information and would not really know what happened. Wouldn't know if they were able to connect with the organization, if services were rendered, etc. So in this platform, that's all happening in real time. So if we were to send a referral off to the Greater Cleveland Food Bank on behalf of a patient, our staff would know if that referral was accepted, when that referral was acted on, and what the outcome of that referral was. So that's all communicated back and forth. And then the final step here, the feedback, as I just mentioned, the outcomes are received. So that's the closed loop that, we would never really have had in the past to really understand what services our patients were able to connect with and receive, or maybe weren't able to connect with, and we need to go back to work to find another option for them so that their needs are fully met.
All right. So kind of as mentioned, United Ohio launched September 22nd of 2020, but currently there are over 970 staff members from various health systems and community-based organizations who are registered to use this referral network. Currently, United Ohio has provided over 7,400 referrals for over 4,200 unique individuals in Northeast Ohio alone. The top 5 referrals used on the platform, the biggest one is always going to be food assistance, followed by housing and shelter, benefits navigation, individual and family support, and then utilities. Patients who receive referrals to date, we have a diversity in regards to age, gender, race, and ethnicity. And the one thing unique about this platform is the ability to be able to track this data to truly target your demographic by region and or other certain demographic currently, like I mentioned, we have over 150 community organizations representing over 310 programs and services currently on this platform who are receiving referrals. And this next slide just kind of gives you kind of like a tableau snapshot of how it would look. So in specific, we said 4,200, so it's 4,237 individual for 7,414 referrals. You're able to see some of those top receiving organizations. So if we talk about food assistance is the main one. The Greater Cleveland Food Bank does receive most of those referrals. The Benjamin Rose Institute. So we're able to kind of really track these. And also, there are what we call out-of-network referrals. So when we have things that people necessarily are not on the platform, but we still use Unitas to track their engagement for that bi-directional data sharing. Out of all of our users, an average user has been sending 32.5 referrals per user, which is very beneficial. And I think as we become more fluent with this system, I think we will also ultimately see these numbers increase.
And I would add that this is, while this is a wonderful tool for the health systems, this is really intended to be a tool for the community. So folks can send and receive referrals completely separate from any participating health system. So for example, again, the Greater Cleveland Food Bank, as they're serving an individual in the community, may realize that they have a transportation need and can do a direct referral to Senior Transportation Connection. So this is really wonderful for health systems, but also, our expectation would be that it also operates completely independently of health systems so that it has the widest utilization and for the most benefit of people in the community.
Yeah. And thank you, Karen. That's great. And to kind of think about what we mentioned earlier, like how do you think Metro Health and Cleveland Clinic are utilizing Unitas to address these social determinant of health needs? So I'll let Karen go ahead and start.
Yeah, I think some of the things have already been addressed, but one key thing is that, our teams have a launch point right from the electronic health record. So we use Epic electronic health record. Our teams are in there. They can connect directly to the Unite Ohio platform within their standard workflow. So that's really important. While, we have certainly excellent staff who, our social workers have been doing this stuff for decades, right? Connecting folks to needed services in the community. Again, this is a way where you can get some feedback on the status of those connections and referrals. And with 150 organizations in the platform, it just broadens some of the options that might be available to people and provides really a level of standardization. So I think folks are great at, building relationships is incredibly important and continues to be really important. But this provides a platform and some standardization beyond what an individual staff member might, develop with another organization.
So one thing about standardization, I'm gonna be very candid, and I believe Miss Elizabeth Fedoris, who's on this call, would actually agree with me, is that as great as the Cleveland Clinic is, a lot of times our various institutions and departments can sometimes be siloed in the way they operate or the way they track. And so when we think about a universal system to make sure that we are all on the same page, that's one thing we're definitely trying to strive for. So before Unitas, people like Elizabeth had to go around to every department, institute to really track the community and benefit and engagement. And I think Cleveland Clinic as an institute is always trying to take it to the next level to truly show the value of our community benefit. So when you think about how we want to improve, we always want to strive for the next step and provide an understanding to various levels of our employees and provide strategic guidance that we're trying to really establish the value of Uniteds and the importance of meeting these goals. So, like, one of our goals is to actually just get used to utilize the actual platform. When you think about any organization, whether you're big or small, anytime you're changing up your workflow that has been in place for years, a new process can sometimes have its own challenges. But we are definitely seeing individuals try to adapt and truly buy into what the overarching goal of this, which is essentially to truly help connect our patients and our clients to community resources to help them meet their needs. And I think we're really seeing that push forward, utilizing this platform within our organizations. And personally, I always love it because I worked for Cleveland Clinic for the last 10 years, and I've always worked in community. So I've never viewed competition between other organizations. And this is one of the first times I truly feel like I'm collaborating with Metro Health and other institutions. And it's not competition, it's really a collaboration. And I think every organization is starting to truly understand that in order to move the needle to address those determinants of health, we have to do it together. So, not to be funny, but we have to unite in order to truly help make that big impact.
That's great. This is wonderful. I do have a question and an observation, but I don't want to jump into that segment yet if you guys are not ready for us to kind of move on to questions and everything like that. So Chase, Karen, is it okay if we kind of start some questions and ask for some other feedback?
Sure.
I'm fine with that.
Okay, great. So my question, this is such great information, and I think it'd be really great if we could share this with folks who are unable to attend. Is there a way we could get a PDF to the slides, or are they only internal? And I understand if they can't be shared out.
I sent these to you, and
Okay.
truthfully, and think about it, as Karen mentioned, the whole goal behind this is to help inform community-wide decisions. So we're more willing to share this with whoever would like this, and we always try to specifically cater it to what people are looking for, whether it be certain data points, certain things, because we do understand people are looking for different information. So we are more than welcome, happy to share any information anybody's seeking.
Thank you. That's great. I will look for those in my email and we will get those sent out with our follow-up email, including the link to this recording. An observation, I did not realize that we had alignment with our footprint and with the footprint that Unite Ohio now covers. So that was really exciting for me to hear that we have folks on the call today who are from all of our different 9 counties in the region. And so I think it's exciting to hear that now through the program, you guys are expanding your own footprint. So I think that's great. And hopefully some individuals who maybe aren't as familiar with Unite Ohio now have a little more information. And as Karen mentioned, the Greater Cleveland Food Bank also, supports this work and participates in it. We did invite them to attend. Unfortunately, just due to end of year commitments and other scheduling conflicts, they were unable to attend today to share a little bit of the same content that Chase and Karen were sharing. But they did share that if anybody who would like to get connected to a community-based organization is interested in connecting with them to get their feedback, that they would be more than willing to share their feedback too. So if anybody's interested, please let me know and I'd be happy to connect you. So those are my couple of observations, questions, clarifications, and I do want to go ahead and open it up. So if anybody on the call has any questions, I'm looking in our chat box too. Sarah, are you seeing anything come through?
I just see
to
some
you?
feedback, which I can share. So
Sure.
someone chimed in, great point, Chase, about how this is not competition. We are collaborating for a greater cause to support the health of our community. Thanks. And then someone else said, thanks for sharing. This is great information. So thank you both.
Thank you. So anybody else, and again, you can add any feedback or questions to the chat box, or if you would like to come off of mute or come on camera, we would be very open to hearing your feedback. I'm sure Karen and Chase have all the answers with this, so this would be a great time to ask any questions or clarify
I don't know
anything.
about that. Don't oversell me. Chase probably has all the answers.
We can give it another couple of moments to allow people. And I know it's a lot to process too, but I think this is great. I think just the provider to provider, closing the loop on some of these items, this is all so timely too, because what we're seeing nationally with factors related to social determinants of health is so important. So the fact that we have a platform that we can address it, and it's right here too in our own backyard, I think is very, very exciting. So we'll give it another minute. I'm not seeing anything else come through the chat.
Chase? Hello. Hi. Hi, my name is Audrey Hudak, and I work with Chase Holmes at the Cleveland Clinic. It's a pleasure to working with him. Chase, how can community organizations who want to be involved, how can they get in contact with Unite Us, and what do they need to do to become part of the platform?
That's a great question, honestly, and I can put something in the chat too. If you just go to the Unite Ohio website, there are informations to contact, and they will set up a demo for you in regards to understanding. That individual will be Maria Geraci more often than not, and she is a phenomenal individual from that team, and she will help you step by step, help your organization enroll onto the platform. And as mentioned, she'll help you do it in a line to what you're looking for. So in regards to receiving and or accepting, or sending, if you just want to just put on certain service on the platform, she'll help you step by step through the actual process. So I'll put that website on the chat right now for anybody who wants to look through it.
And thank you so much. And Karen, could you give some examples of some of the community organizations that maybe beyond food needs that are on the platform? So who should join?
Yep, so we do have 150 organizations across these 20 service categories, as Chase mentioned. So that includes food, housing, individual and family support services. We've got, a fair cluster of services that serve older adults. So Benjamin Rose Institute on Aging, Western Reserve Area Agency on Aging, Senior Transportation Connection, Care Patrol. There's some, family caregiving support organizations that you'll find on there. We've got a couple of departments through the city of Cleveland, actually. So we're looking at municipalities and services that they may provide that are relevant for the platform. So it's really fairly far and wide, to be honest with you. There are youth serving organizations, our digital connectivity partners are on the platform. So Digital C, ASC3, that whole cluster of organizations. And we really try to encourage organizations who join to think about who they work with closely, because it's really most beneficial if the folks that you're already partnering with are also on the network, and it's just another way to solidify the work that you do together.
The size of the organization matter, or are there small organizations and big organizations?
Yep, it really, yeah, we've got an organization I can think of that's a two-person shop. And then we have Catholic Charities that has a huge footprint across multiple counties and multiple service types and service locations. So to Chase's earlier point, it doesn't need to be an all or nothing. So we've got some large organizations that are maybe opting in with just one or two programs, but others that are all in, and then certainly smaller organizations. And sometimes the smaller organizations find real benefit because it can help with some of their own client tracking in ways that they've not been able to do before. So any participating organization has access to a level of data that can really show their activity on the platform and what that's resulted in.
Hey, this is Chantel. I have more of a comment, and thank you, Chase and Karen. And one of the benefits of having Chase on our team is that he has done a phenomenal job in being able to translate the importance of Unitas and what it does. And one of the things that he always says to me is, Chantel, it's, working in Unitas is just bigger than the platform. Continue those partnerships and relationships, right? It's not just about the click and the efficiency of being able to make the referrals and finding out the outcomes, but, to what he spoke to, with regards to the relationships, that it continue to be bi-directional, and it does require in person, or not just, but just, face-to-face discussions, be it via Zoom or Teams or whatever, but it continues cultivating relationships. But one of the things that I will say is that our team, we continue with, especially with regards to our projects that are happening in 2022, we continue to engage partners and asking for their participation on the Unitas platform, because it helps align the work that we're doing and helping us with making sure that we do streamline those referrals. So we do appreciate having this platform and introducing this to partners. Just because there's existing partners on this platform currently, we encourage people to participate and add partners, because we want to be able to, be able to broaden our reach and have as many resources as possible, because we have folks who have so many needs, and sometimes some of our partners are to capacity. But I just want to thank you both, because you all have done a phenomenal job in being able to communicate the importance of this platform, being able to align the healthcare systems and our partners. And essentially, no pun intended, it does unite us. So
Thanks, Chantel, and thank
Thanks.
you, Audrey, too.
Chase and Karen, I did have one quick question. The insight screen that you were showing, is that something, and I'm sorry if this is a dumb question, is that something that's available just to sponsors, or is that something that all of the CBOs that participate, they can see their own referrals in that sort of
First of all,
format?
never a dumb question. Every question is a good question. That's first and foremost. And secondly, yes, once a organization joins, now I will say this, I believe it may only be 1 or 2 licenses per organization. If I'm correct me, I'm wrong, Ms. Karen. So it's almost like you will have a select individual who have access, who can share with the rest of the organization, no matter the size of it. So like even for Cleveland Clinic, we have 2. So it's like me and our analyst share it with everybody else internally. But at the same time, certain organizations, they do have other dashboards in order to really work with this. So like for our organization, we're trying to build internal dashboards to more so share it, so everybody in our organization will be able to see it. But yeah, everybody will have access to data from whoever joins the actual platform.
Thanks for
Thank
that
you.
question, Sarah. And then it looks like Chase did add the link into the chat box, and we will also share that out in our follow-up email as well. But that is available in the chat right now if anybody is interested in taking a look. Any other questions for Karen or Chase about Unite Ohio before we move on? Great. Karen, Chase, thank you so much. This is great information. I'm so excited we were able to have you share this. And again, it feels very timely in response to the feedback we received in June. And also just in terms of the conversation this morning, it feels like this is really great information for our partners to have. So we thank you so much for taking some time to speak with us this morning.
No problem. Our pleasure.
Thank you. Appreciate the opportunity.
Thanks. All right, we are going to go ahead and move into our next session, which is essentially our wrap up and our conclusion. So I'm going to go ahead and share my screen. Sarah, are you able to confirm if it's displaying? Okay, great. Thank you so much. So at the last regional convening, we did ask this question, and we do just want to take a few moments to open this up again. We are going to be sending out a follow-up survey that will include this question, but just for the sake of circling back and making sure that we're collecting all the feedback that we can, we are curious if there is something specific you would like to see at our next regional convening. So as we're thinking about our programming for 2022, we do intend on having these regional convenings perhaps 2 to 3 times a year, just bringing partners together. So I think we're just interested in hearing any feedback like we received at the last convening about what you'd be interested in seeing. So if you have anything that you'd like to share by coming off of mute, we welcome that. Or if you would like to add anything to the chat box, that would be very welcome as well. And as I mentioned, if you need some time to think about it, we understand. So we will be sending out a follow-up survey. Sarah, are you seeing any comments in the chat box before I go ahead and move on?
I am not now, but yeah, I'll just
Okay.
second what Libby said. Please, we're very open to feedback. We want this to be, a great use of people's time. So if there's things that you would like to see, please, just send those ideas to us. Thank you.
Thanks.
Sarah and you guys, can I interrupt? Do you mind, Libby?
Yes. Nope.
Sorry, it's Elizabeth. I just wanted to, and I'm thinking here, just really reveling in all the amazing work that everybody's doing, and just thinking back when we talked about a regional approach to community health. This is what we wanted. We wanted everybody to be able to talk about those successes, those strategies that work. And I just wanted to emphasize how wonderful that's coming about with the Northeast Ohio website and you all directing it. And I know that we spend a lot of time and energy and dollars on the CHNAs. And one of the discussion points we've had is over time is, can we not spend all that time on developing the needs? The needs are the needs. They're going to be there. They're going to show up. And by the time we've gotten through mega, folders of data, we don't have much time left on the strategy. So just today's example, just looking at one piece, one strategy and how that works for all of us is just really wonderful. So I'm wondering if we could just choose those needs that we have in the CHNAs from any of us for the next discussions and just have, whether it's digital access or whether it's infant mortality or lead poisoning or chronic disease, or any kind of access or structural racism, and just pick one of those topics and invite, a discussion around those. I just find it so rich that, it just, that's the emphasis of this work. So I just wanted to throw that out.
Thank you, Elizabeth. No, thank you so much. That's a great comment, and we appreciate that. I think we are definitely interested in perhaps inviting other individuals who use the same platform as us, but have maybe looked at items and indicators regionally in other states as well. So I know that that's something that's been on our radar. Sarah, I'm trying to think if there's anything else that we have thought about maybe for future regional convenings that are kind of along the lines of what Elizabeth just shared. If you wanna share anything.
I know we had talked about, this concept of even like breakout sessions. So breaking out the group, maybe each focusing on a different need or strategy and then coming back together for discussion. That's something else we've thrown out. But Elizabeth, I do appreciate that feedback. And again, Karen and Chase, thank you so much for that presentation. That was so helpful. And I think, just highlighting things like that, strategies moving forward. I agree, Elizabeth. I think that would be really helpful and useful to the group. So appreciate that feedback.
Yes, thank you, thank you. Okay, I'm going to go ahead and move on to a couple more of our wrap-up slides. We did want to share a few upcoming opportunities with all of you. We do have part 3 of our webinar series that will take place next Tuesday, December 14th. That's about a half hour long. That will be at 1 to 1:30 p.m. and that will also be through WebEx. So this session will focus on community conditions, and we will be hearing from Dr. Darcy Freeman, and we will be specifically talking about food insecurity. We did already have our Ashland County webinar a few weeks ago. It is recorded and available in our resource library, but I did want to mention that we are in the works of planning our Geauga County specific webinar. I believe we are talking about January 20th. I think we may have just confirmed that last night. So please be on the lookout for information about that and feel free to share. We will be focusing for that webinar specifically on Geauga County data, the Geauga County page that we created for them. However, if you're new to the platform, this could be helpful even if you live in a different county or work in another county as well. So we did want to share information about that. We also have our 4th quarter newsletter, our data dispatch, that is going to be distributed next week. So we will have information in that newsletter about our site updates. We will have a recording of this session today that will be in there as well, and any other upcoming opportunities or resources that we think might be helpful to all of you. And then you can always feel free to, before I move on, Sarah, are there other on the horizon items before I move on? I don't want to jump ahead.
No, I think you've covered them.
Okay.
Thank you, Libby.
Thanks. Okay, so we are going to wrap up, and you can always feel free to reach out to Sarah or I with questions, of course, through email, through phone, or through the Contact Us page of the website. But before we totally conclude for today, we do want to wish all of you a very happy and safe holiday season. We thank you for your continued engagement and support, and we look forward to further collaboration in the new year. So thank you so much, and we hope that you have a great day. Bye, everybody.
Thank you so much.
Thanks for all you do, Libby and Sarah.
It is our pleasure, truly. Thank you. Thanks so much.
Have a great day.
Bye.